Coming up,
We don't carry your basic flour in the store.
come for the coffee and stay for the flowers. Or come for the flowers and stay for a coffee. Join us at this SoFlo staple that's been in business since the 70s. This staycation spot in Miami Beach features a wellness program, and Dr. Sam has some remedies for that nagging lower back pain.
All that and more is today on SoFlo Health. Hello and welcome to SoFlo Health. I'm Hunter Frankie, and today we are at Uma House in Miami Beach. It's a luxury boutique hotel that has a wellness program we're here to check out, but it's also a great place for a staycation, especially if there's something going on in the convention center that you want to see. They have a Pilates situation set up for me upstairs right now, so let's just get right to it. Uma House has a wellness program, and a part of that program is a Pilates class. This is Ale, and she is the instructor for that class. So we're going to show you a few moves of what it looks like when you're doing Pilates without a reformer. And then we'll get more into the rest of Uma House. So Ale, take it away.
So we're gonna start on our hands and knees.
Okay.
On the mat here. Just gonna place our hands directly underneath our shoulders, knees are directly underneath our hips. So we're just gonna extend our left arm forward and our right leg back, really sending energy through the tips of our fingers and toes. And on my count, we're gonna bring elbow to knee. So in 3, 2, 1, bringing our elbow, crunching it in towards our knee, scooping our belly button to spine, rounding our back, and stretching back out. Beautiful. So coming up to stand at the top of our mat. We're just gonna bring our left leg back straight, and we're just gonna come into a lunge. So coming down into a lunge and lift. So we're inhaling to lower and exhaling to lift. Great. Bringing those legs to a 90 degree angle, working that front leg. Beautiful. So coming to our knees, you should have your weights in your hands. We're gonna come onto our knees, and we're just gonna send our arms where they're pressed next to us, and we're gonna send them forward. We're just serving the platter, really squeezing those weights as we extend and bring them back in. There we go.
That's great. You know, it's funny, something as simple as that I wouldn't think is doing much until I start to, as you think about your breath, as you hold the position, then your body's like, all right, we're all engaged now. What is the key to Pilates? What are we working on when we're doing Pilates?
So everything with Pilates, you're really working your powerhouse, which is kind of the core of everything we do. So it's great for your posture, for your mobility. Any lower back pain can usually be fixed with Pilates because it works your core.
Great. And how does that all tie into Uma House and what they're looking to do here?
Yeah, so wellness is such a big factor of everything that Uma House does, and it's great because the guests get to experience this Pilates class where they come, they work out in the morning, then they feel amazing for the rest of the day, and so it's really special.
Yeah, and you have this beautiful rooftop space with a gorgeous view. It is hot out here today, but that's totally fine. Get a little extra sweat in while you're doing your Pilates and having a class here. What other sort of classes do you guys do here?
We have yoga class, they do sound classes sometimes, sound and bath classes.
So this is just one of many things that they do here.
Yeah, they do so many things.
Great. Well, I'm going to continue to explore Uma House. Thanks for giving us a little bit of training here on Pilates. Really appreciate it.
Thank you.
All right, let's go. Keep going. We're now joined by Patricia. She's the general manager here at Uma House. Patricia, thanks for joining us today.
Thank you. Thank you for having us, and thank you. Welcome.
Of course. I just did the Pilates program, and it's a part of your wellness program that you have here. It's a little hot outside, so I'm a little sweaty, but I feel great.
Good.
Why is it important to have wellness as a part of your brand?
Well, we believe in wellness. We want people to be healthy, and when they are away from home, it's a great thing to have for us to be able to have them do exercise and go to the beach and take a run. So our wellness program is just going to keep growing.
Great.
What you saw today.
And for those that aren't aware of what Uma House is, what is it?
It's a boutique lifestyle hotel. We have the luxury of being in prime location from the beach, from Lincoln Road, from nightlife. We have 2 rooftops. We have a gym, and if you're here for business, we have a wonderful meeting room space.
Well, Patricia, thank you so much. If people would like to learn more about what you're doing here, how can they?
We have our website where they can get all kinds of information about what's happening within the month and our rates and any event that's happening in the city.
Wonderful. Well, thank you very much. We're not done here at Uma House, so stay with us at SoFlo Health. But first, watch this.
Today's a very exciting day as we are back at 5 Element Wellness Center, and I'm joined by Dr. Monique. Dr. Monique's very excited as she just found out that this is going to be my first time ever having acupuncture. So you asked me a series of questions. What are the important things to know before you begin acupuncture?
So we want to know the patient's lifestyle. What are your stress level? How's your digestive system? Are you having bowel movement? What is going on as far as work?
Yeah.
So by the time you're done with the treatment, you should feel pretty relaxed.
So I guess there's nothing to it but to do it.
There you go.
Here we go. All right.
That's all you're going to feel. You have a needle in. If there's a point that's more sensitive to you, just let me know. So the points that we're doing right now are all along the bladder meridian, but they're actually connected to different organs in your body. And that's how we're actually treating everything in your body at the same time. So they're correspondent. Yes, so that's your digestive system right there. This is still a bladder point, but that's the attachment of the muscles as well. Yeah, so these are for the tightness on the neck.
I survived.
You did. You did great.
Yeah, it felt great. Kind of like tense in the area for like maybe a minute or so each one, and then it slowly would dissipate. As far as how I feel, Dr. Monique, thank you. I feel great. I definitely am probably much more relaxed. Is there anything else you think we should know about acupuncture before I let you go?
A lot of people only look for us as a last resort. And so historically, people actually went to acupuncture not to get sick versus let's fix what's broken.
Yes, and if people would like to find out more or try it for themselves, how can they?
They can call the office, they can go into our website, they can come in, do a consultation. We'll create a treatment plan exactly for them and their issues.
Cool. Dr. Monique, thank you so much. I think it's nap time for me. Come right back for a latte and happy arrangement at this Las Olas locale when SoFlo Health returns.
Focusing on you from your team of experts at Sylvester Comprehensive Cancer Center, South Florida's only National Cancer Institute designated cancer center.
After 31 years with Miami-Dade County Public Schools, Charlie Burr was finally enjoying retirement. But when he was diagnosed with cancer, his reaction was different than you might think.
God, why not me?
Charlie had non-Hodgkin's lymphoma. He went to see Dr. Denise Pereira, Associate Director of the Transplantation and Cell Therapy Program at Sylvester.
Lymphoma is a form of cancer from the lymphatic system. It can affect some different areas, including lymph nodes, spleen. Also, it can affect the bone marrow.
Charlie faced a bone marrow transplant. Then Dr. Pereira offered an alternative, a study using CAR T cells.
The T cells are the soldiers of the immune system. Once those T cells are removed and then intentionally modified, the cells are now capable to see the cancer and attack and destroy.
Because Sylvester is a National Cancer Institute designated center, patients have access to cutting-edge clinical trials. Charlie is the first patient to receive a form of CAR T-cell therapy and is now cancer-free.
Because those cells had come from a donor, you're able to reduce the time he had to be treated.
Charlie is back to his love of barbecuing. He says Dr. Pereira and his faith pulled him through.
And I'm thankful that God put her in my life.
Welcome back to SoFlo Health. I'm Hunter Frankie. We're at the Sunrise Tower now at Uma House. Earlier we did a little bit of a Pilates class as a part of their wellness program, but this is also a great place to have a staycation or even a little work from home situation. I can see myself doing some work over there, but I'd really just rather relax. Local businesses are what give the soul to the places that we live and frequent. I'm on Las Olas in downtown Fort Lauderdale, and we're at Ann's Florist and Coffee Bar, one of my favorite spots. And you heard that right, it's florist and a coffee bar. Let's go meet Taylor on the florist side first.
We are at Ann's Florist and Coffee Bar on Las Olas Boulevard. We're a florist, we are a cafe, and we are a full bar. Originally, we started in Hollywood, Florida in the 1970s, and we were a greenhouse. Over the years there, it kind of evolved and we became a florist. And then in 1992, my uncle is the one that opened this store on Las Olas. We order flowers from, I would say, 6 different continents. We don't carry your basic flower in the store. We try to create like a more unique style floral arrangement.
Things have changed since the 1970s when my mom was first in business. Now there's more freedom. You'll see a lot of up-and-coming florists, a lot of young people coming into the business that don't follow the rules. It's a lot like art or fashion design. You'll break rules here and there and a new movement will come out, but for the most part, mechanics should be sound.
Now, I'm guessing that your mom was Ann?
Yes, yes, she is. And she was self-trained. She's good at pretty much everything. She can paint, she could draw, she could do a lot of things, so this is natural for her.
That's lovely.
Yeah.
We were talking earlier with Taylor about how this is such a staple for Las Olas and just South Florida in general. To me, this is part of what gives Fort Lauderdale its feeling.
And that's probably the thing that makes me the happiest about the business, is something that's recognized on probably one of the nicest streets in the county. Is something very satisfying.
What is this that you're putting?
Okay, so this is called dianthus. It kind of looks a little kind of prehistoric, but it's actually in the carnation family, and it's been hybridized to be fluffy and the color. It's known for its chartreusey green color, which is what everybody likes. And it lasts like 2 weeks, so it's a long-lasting flower.
Here we are.
Yep, ready to make someone happy that's been having a bad day.
It's making me happy, and I'm having a great day.
Well, good. Well, very good.
Question I have for you. How do you care for something like this?
The main thing is you want to make sure it always has water. The tendency is you bring flowers home or someone sends you flowers, you look at them the first day, and then you don't look at them for 5 days and you go, oh my gosh, it's dry. Fill it up every day.
Every day.
Water is important.
Okay.
Yeah.
And what's the biggest mistake people make besides that?
Probably putting it in under an air-conditioned vent or in the direct sunlight.
Oh.
A lot of people think they need sun. It's a cut flower, so it really likes light, but not direct sun.
Okay. Well, Kim, thank you so much.
Well, thank you. I appreciate it.
Yes, definitely. I'm going to go check out the cafe.
I know.
Have
fun. Bye-bye.
Taylor, Mom's great.
She is.
She knows.
I think I'll keep her.
Yeah, I think so. And she knows so much, and she's just spilling with knowledge. I definitely have to come back maybe around Valentine's and learn a little thing or two from Mom.
It's a whole nother animal.
It is. And so is all of this. What are we looking at here?
So starting off, I mean, you had your eye on this one. So this is our blueberry tart. Then we have our tiramisu, and of course, I would say a favorite, the spicy beef empanada.
Yes.
Our traditional latte. And then, of course, our biggest seller, if you can believe it, the espresso martini.
Yes, there's a little something for everyone here. If you want some coffee, you want
exactly.
a drink.
Sweet, savory, coffee, alcohol, touching all bases.
You can do some breakfast. You can have a little snack late night, come for a treat.
Absolutely.
And you've got something interesting directly behind you. What's that?
Oh, yes. That's our Moet vending machine. So,
it's a crazy thing to say.
I know, and it's so funny because people come in and be like, do people ever get that? I go, absolutely. That is a big reason why people come in, because they see it like on our Instagram or on other people's Instagrams, and they come in just to like take a video of themselves doing it.
I mean, that's today's age, I guess.
I agree.
Got to go get a champagne out of a vending machine at the Cafe Florist and then put it on Instagram.
That sounds right.
It all adds up, right?
Yes, absolutely.
And of course, you have the full bar for people who want to come and hang out late night.
Absolutely.
So when it comes to everything we've seen here today, what would you say makes Ann's Florist Ann's Florist?
Our family, to be honest with you. One of us is always here, and even our staffs, I feel like they treat this place like it's theirs as well. So we couldn't do it without our amazing team, and then of course our customer base that have been our customers for the past, almost 50 years.
Is there anything else you'd like to share you think we should know?
I mean, there's always something going on. So we do baby showers, bridal showers. We have live music 4 nights a week. So I mean, there's like you said, there is something for absolutely everyone here of all different age groups. So I think that, if you haven't been here, then definitely come and try it yourself.
Great. And once more, if people would like to find out some more or follow along, how can they?
Follow us on Instagram. That's the biggest thing. It's Ann's Florist and Flower Bar, and we post everything on there. So I would say definitely, if you want to get inspired, definitely check it out.
All right, Taylor, thank you so much.
Thank you so much.
You got it. Unfortunately, chronic blood cancers affect a lot of people. That's why we're here at Mount Sinai Medical Center today to meet with Dr. Barrientos, who's going to tell us more about it, and specifically CLL. What's that? Well, don't ask me, ask the doctor. Let's go. I'm now joined by Dr. Barrientos. Doctor, thanks for joining us today.
Thank you so much for inviting me and having me here.
Of course. Now, it is Blood Cancer Awareness Month, correct?
Yes,
And that includes CLL?
it includes all the blood cancers, chronic leukemias, acute leukemias, lymphomas, myelomas, any blood cancer that you can think of.
And why is it important for us to raise awareness about CLL?
CLL stands for chronic lymphocytic leukemia. It's the most common chronic leukemia in the US and also in Western Europe. We diagnose about 20,000 new cases in the United States every year.
And what sort of warning signs are there or symptoms that people would be experiencing?
So believe it or not, the majority of patients are diagnosed without having any symptoms. And the reason for that is because the most common finding on a complete blood count can be that your lymphocytes are elevated. And your doctor just thinks, oh, it might be an infection or inflammation.
Right.
And then because it doesn't go down, you get to be seen by the hematology doctor. And that's when we do blood work and we discover that you actually have CLL. So because I am a specialist in CLL, I have seen families where there's an immediate family member or there's cousins that have CLL.
Wow.
So it's one of those things that you should be aware of the diagnosis and the disease, just so that you know what to look for when you see your doctor.
What is the outlook like for those that are diagnosed?
So the good news is that we just published data on our long-term follow-up of patients treated with the novel targeted agents, and we proved by doing clinical trials that the patients can expect to have a normal lifespan. It's similar to patients that do not have CLL.
Wow, that's very exciting. I got goosebumps when you said that. That's a huge change. Well, thank you so much for your time. We really appreciate it.
Thank you so much for having me.
You got it.
Lower back pain? Dr. Sam Rasool has some helpful stretches after the break on SoFlo Health.
We've been on 2 rooftops so far here at Uma House. Welcome back to SoFlo Health. I'm Hunter Frankie. It's hot out here. It's enjoyable, but it is hot. So let's head inside and I'll show you some other special stuff they have going on here. But first, watch this. We're back at Shin Wellness with Dr. Sam Rasool, and today it's everyone's favorite subject matter, and that's lower back pain. Everyone has a different story of their lower back pain and a different solution, seemingly. So once and for all, what's the best stretch that we can do for our lower back?
There is no one singular best stretch. Let me show you what I mean, Hunter, because you want to know what causes the back pain to give the best stretch. Go face down for me.
Sure.
So the biggest thing, Hunter, is that if you have different symptoms that cause your lower back pain, this is indicative of disc pressure on the lower back or nerve irritation. So what you want to do is take the pressure off of that, and to combat the posture, you want to do a back extension stretch. So put your hands up here and then just go ahead and push up. Using the hinge of your hips, now go back down. You want to do this a couple times.
And how far up does somebody need to go?
Just to the point where the hip stays in contact with the floor and or the yoga mat if you're on one.
Right.
This is going to help you if you have disc impingement. This is going to help someone who has problems when they're sitting.
So this is for someone, if I'm sitting here and I feel like my back, it's kind of pulling and painful. That's the kind of pain I'd be experiencing.
Exactly. Also, if you feel any kind of discomfort, if you cough or sneeze, you're like, ooh, I felt something. Not necessarily pain, even tightness. Could be a disc issue.
Okay, and what is another issue you might experience that's also lower back pain?
A lot of times people that come in my office, they're like, wait a second, doc, I actually feel pain when I'm standing too long, or when I get up from a seating position, I can't really extend straight up. It takes me a little bit of time, especially in the morning. For those people who are having the kind of facet, with the standing, you want to stretch the lower back. So getting a big exercise ball, draping yourself over it like a tent, and or doing a child's pose in yoga is going to help you out tremendously. Or if you're in a doctor's office, go face down.
Sure.
One of my favorite techniques we do in the office for the patients, we're going to have Hunter slide down for me. It's called flexion distraction. I'm actually going to unhook this portion of the table. It's going to come down just like this, and I'm going to place my hand just like this on the joint, and I'm gonna stretch him out. This is taking the pressure off of those joints in the back as well as the nerves, and actually does do justice for the discs as well. Come on up.
All right. That feels very similar to when I do a hang. Is it a similar release?
Exactly. You're trying to achieve the similar things, and when you hang, a lot of people can try to do things at home where they're trying to basically open up their lower back. This is doing it more from a specific standpoint. I'm going segment by segment to make sure we open your back in the exact position.
One last thing I would like to wrap up on is when people are dealing with neck pain, lower back pain, any kinds of pain, everyone knows that there's probably some discomfort you need to work through. But then there's also some discomfort that it's telling you, stop, you need to stop right now. How do we know the difference?
Great question, Hunter, and I hear this all the time. People are like, should I push through the pain? Obviously, we heard about it in the gym. So I always tell patients, you want to ensure that you have full range of motion in your joint, then you can start to implement.
Right.
So if you feel certain pain, it's still a thin line. It's very difficult to assess. That's why I always say under the supervision of a professional is the best way to do it.
Great. Well, Dr. Sam, thank you so much.
Thank you.
You got it.
Before we get back to Uma House, here's SoFlo Home Project host and design expert Elena Capra with a preview of today's show. What's up, Elena?
Hi, Hunter. It's good to see you again. We are now in our new Sunday time slot throughout all of college football season. Later today on SoFlo Home Project, join us as we share with you ways to beautify your home with natural materials.
Welcome back to SoFlo Health. I'm Hunter Frankie. Had a great time at Uma House so far, and there's plenty to enjoy while you're here. Something I really do enjoy about this place is the wellness aspect. Not only have they had the Pilates and the other events that they do here, but even a little touch like in the room here. It's not a plug for a certain brand, but they've got a healthy snack bar, not just candy and chocolates and things, which are all fine if you want that. But for somebody like me looking for a high protein snack that's good for you, having this available is nice. And after all, the whole idea of being at a hotel is usually to relax, so I'm gonna take a nap here in just a minute. But that's all we have for this week's episode of SoFlo Health. We hope that you learned something or that you enjoyed this. Dr. Sam was helping us with our lower back, and we'll see you on the next SoFlo Health. So here's what's coming up.
I try some new technology that scans your feet to find you the perfect fit so you can keep your body in alignment.
If you want to catch up on what you missed on this episode or any previous episodes of SoFlo Health, you can do so on SoFloShows.com. You can also follow us to share with us what you're doing to stay healthy. Until next week, it's goodbye, good health, and good night.